Hi, Dr. Jen. I'm a fertility doctor. Thanks for your question about this video. So for an egg retrieval, the question is about anesthesia. So in this case that I was showing, the patient did have anesthesia. There was an anesthesiologist in the room, and she had what can be called IV sedation. So she had an IV line in, and she was asleep during the procedure, but she was breathing on her own. General anesthesia that you might get when you go to a hospital, you might have a breathing tube in. So this patient didn't have a breathing tube. She was breathing on her own, but she did have what's called IV sedation, and there was an anesthesiologist in the room. Now, we are an outpatient fertility center, and we do sometimes do egg retrievals while patients are awake. It's more common to do them when you're awake, when you generate fewer eggs. So I would say it's more common when a patient has 3 or fewer eggs. They may elect to not do IV sedation, but they might get what's called lidocaine, where I'll numb the area and we'll do the egg retrieval. My patient is awake, when there's fewer eggs, it's less uncomfortable, I would say, and I think that is a good option. Not everyone chooses it, but I like to give my patients options. You definitely have both options here, to do the egg retrieval with IV sedation or to do the egg retrieval when you're awake, and you would get some numbing medicine and can also get, say, a Valium ahead of the procedure. Let me know if you have any other questions about this. I know this topic is talked about a lot in terms of anesthesia and pain control during egg retrievals, so let me know if you have any other questions about this.